Hello and welcome to another exciting episode of the Voices for Self-Care, the #1 show advocating for self-care in Nigeria. My name is Oyari and I'm excited to be your host on the Voices for Self-Care. Now on this show, we advocate for moving national policies for self-care from just mere policies into practice. If you're just new to the channel, a very warm welcome. And if you're just joining us, please do make sure to subscribe, like, and turn on your post notification to ensure you get notified anytime we make a new episode. Now, today promises to be another enlightening session as we'll be delving into one of the most critical aspects of the concept of self-care, which is service delivery. We'll be touching on areas such as what self-care commodities are available and where to find them, the challenges around finding them and all that. We have a very special guest who will be joining me in dissecting this topic. But before we go into it, if you've not subscribed again, please make sure you subscribe. We'll go on a short break and when we come back, we'll delve right into it. Welcome back. This is the Voices for Self-Care podcast, the #1 show advocating for self-care in Nigeria. And today we'll be talking on the topic policy to practice service delivery for self-care intervention. And joining me in dissecting this topic is a medical doctor, a public health professional, and the Assistant Chief Program Delivery Officer of the Society for Family Health. Ladies and gentlemen, my esteemed viewers, please join me in welcoming Dr. Anthony Nwala.
Thank you very much, Ryan.
I trust you're well.
I'm very well, thank you.
Okay.
Yeah.
Okay, sir. So we are talking about policy to practice. Before we delve into that, we would like you to introduce yourself.
All right, thank you very much, Oyare. My name is Dr. Anthony Nwala. I work for the Society for Family Health in Nigeria. Society for Family Health is an indigenous organization. We've been in the business of healthcare for Nigerians for 41 good years.
Amazing.
Yes, and I must say it's been a fruitful journey. We've not gotten to where all of us want to get to, but it's important to know that we are on that track. Looking at the last NDHS that was just released, I think we need to pat ourselves on the back and know that we are really making some impact. Thank you very much.
Thank you very much, sir. Okay, so we're talking about self-care. We're talking about moving self-care from policy to practice. And we want to touch on the area of service delivery for self-care because it is, you know, the whole concept of self-care hinges on effective service delivery,
Actually,
right?
yeah.
So my first question to you will be, how would you assess SFH's progress in making self-care commodities readily available and accessible, especially at subnational levels?
Yeah, thank you so much, Oyare. The concept of self-care is not new, right? Mm-hmm. Over time, there's been this concept. When we were younger in practice, you teach women how to do self-examination, self-breast examination, self-testings, right? And then you do self-caregiving, you tape sponge a child at home. Those are all just to give you an idea that the concept of self-care is not new. However, in Nigeria, in the pursuit for universal health coverage, right? We found out that one of the pivotal vehicles to achieving universal health coverage in Nigeria will be through self-care, right? So, and self-care, if you look at it in that direction, self-care is now more or less an innovative means of, bringing in more stakeholders, which includes self, into the management of health. So, for us as Society for Family Health, we started working in the area of self-care and with self-care products long ago, right? However, around 2017, 2018, in Society for Family Health became the market authorization holder for DMPA-SC, which is dichloromethylhydroxyprogesterone acetate subcutaneous injection. And that was used as a product to showcase self-care, right? Of course, there are other products. Self-care, you have self-management, self-awareness, self diagnosis. These are all come together to make up the concept of self-care. So for us, that's when we started actually, promoting self-care with that particular product in view as a vehicle to achieving universal health coverage.
I'm so particular about, I noticed they've made so much progress, SFH has made so much progress since 2020, in creating awareness and using innovative measures to push that awareness and to, just basically self-care interventions. But right now, I'm concerned about where are we? Are we still at the stage of awareness? What about commodities, accessing the self-care commodities themselves? What self-care commodities are available? Are they really accessible at subnational levels?
So, well, fine. We've traced the area of awareness, behavioral change, right? Like the topic of today's discourse is service delivery. Self-care in its definition, which is important to point out, is not boycotting service delivery, right? Not boycotting healthcare
professionals,
providers, right?
Yeah.
So, in service delivery, we also made sure that providers at the facilities understood, because they will initiate self-care. Even providers outside the facility, but providers generally will initiate self-care. So we made sure they understood what is the impact of self-care, what are the barriers, and one of the barriers was fear, right?
Okay.
We'll talk about barriers.
We'll talk about that, yeah.
Yeah, so the providers at the healthcare facilities were made to be aware, and then the issue of self-care products and services, commodities, was also, addressed. So we looked at what are self-care products and services that are available. Like I said, you have self-management cares like the DMPSC we mentioned earlier, which is self-injection. Of course, there are other things like self-testing for HIV/AIDS, self-testing for HPV. Those were there. But focusing on self-injection, right? We made sure that at the facilities, where will clients, assess these products? At the facilities, are the products available? At the Federal Ministry of Health, do they do proper procurement? What is the quantification at the local government level? We're talking about national and subnational levels.
Yeah.
So do we do proper forecasting and requisitions at the LGA level to the federal level? So that's what we did. We made sure, and providers were trained, because this is service delivery. They were trained to counsel and initiate clients on DMPASC.
Amazing. So let's talk about the providers now, the healthcare providers. How trained would you say they are right now to, train communities for self-care practices right now, this moment?
Let me take, for instance, the DISC project, Delivering Innovation in Self-Care project. Initially, for the first 4 years of implementation, we worked in 12 states, right? 15 states, initially 3 states, and then we added on 12 states, 15 states. In those 15 states, we have about 916 LGS, right? And we covered 96 of those LGS. And we were able to move conversion rate. Conversion rate, to explain it to you, is a proportion of women who have made a voluntary choice to use DMPSC as against those of them who are self-injecting at home. We moved conversion rate from 13% in Q2 of 2021. Okay. As I'm talking to you, conversion rate is hovering around 60-70%.
That's an impressive.
In those areas. Okay. So providers, I would say providers are aware, providers are trained, clients are aware, clients are using. But that 60-70% conversion rate is it's a drop in the ocean, right? So what we need currently is not just providers being trained, but how do you scale these trainings? How do we in Nigeria scale this innovation? Okay. Because our population is big.
It's enormous.
Yeah.
Okay, so let's talk about the recent updates of the self-inject policy. Can you just kindly explain the rationale behind increasing the number of doses of the DMPASC provided to women? Can you just tell us what's the rationale behind increasing the doses?
Okay, so when we started, like I said, with the DISC project in year 2020, we started looking at structures that will entrench, that will institutionalize self-care in Nigeria. And that's policy. You know, we're talking about policy to practice. So that's policy. And that's when we worked with other implementing partners and the Federal Ministry of Health to domesticate the self-care guidelines, SRHR, self-care SRHR guidelines, to our Nigerian context. We facilitated that process. Now, it's in as much as self-care is not new, but the concept of self-care, the way we brought it, was something we are going into newly as a country, right? So we had to have frameworks, we had to have policies. And we were mindful of the fact that we didn't have enough evidence, let me put it that way. Now, moving forward, 4 or 5 years later, we have implemented, we've interacted with other countries where self-care has been implemented, and we have tons of evidence. We now look back at our policies and we saw that there are a few things in that policy that were limiting, and that's where that change came from. One of those things was the when a client comes to the facility to initiate self-care, how many times does a provider need to see that client before, after training, the client is adjudged proficient, right? We looked at that at the policy. The initial policy said at a minimum of 2 times. The current policy has been revised with evidence to say even at first visit, a woman can be trained and self-inject before the provider and are judged competent. The next is number of take-home doses. The initial policy said that you can only give, so following from the woman comes the first time, you can't, even if she's proficient, you can't initiate in the first policy until she comes the second time, right? So that's, you're seeing that woman, the second time will be 6 months later, because the self-inject DMPSC is a 3-month method, right? So at that 6 months, she's competent. You now give her 2 doses, right, to complete a year. So she can come back to you, after the next 6 months, making it a whole year. That's the first policy. But like I said, with the tons of evidence we have today, we say you can initiate a woman at first visit, and then you can give 3 doses.
3 doses.
If you have stock, minimum of 3 doses, right? So that's 4. You've covered that woman for a year. You get it? So that's the rationale. And self-care in its entirety means that you want to reduce the pressure on healthcare facility-based providers. So of course, the woman can come back anytime, can reach out anytime, but the longer the woman is away from the facilities, the more you achieve those particular aims of, initiating self-care. So that's the rationale.
I understand. That's really amazing. So I'm just concerned, have you noticed any significant increase in the use of self-inject since this policy has been reviewed and since the dosage has been increased? Would you say you've noticed any increased or significant increase in the use of self-injecting?
So, Oyare, what has happened over this period of implementation is that a lot of demand has been generated.
Amazing.
And to meet those demands has been a challenge.
Oh, wow.
So stock is not available. The policy says you can give a minimum of 3 doses, which means you can give more than that. But will you give if you don't have? You won't give if you don't have. So the policy has just been revised. You won't see those changes until, based on the policy, if we see women, and you won't take, it's not compulsory. It's for a woman who requests for it, right? Now, when we start seeing women making those requests and using those evidences to increase forecasting and procurement, that's exactly when you'll be able to merge what the policy has been able to push in terms of number of increase in uptake, right?
Yeah.
But now this policy just got revised. We'll soon launch it, and then we'll, based on the policy, we'll advocate to the powers that be on quantity forecasting and quantity procured for the women in Nigeria, putting into consideration those take-home doses.
Thank you very much, sir, for that answer. So let's talk about challenges. Speaking about challenges, what would you say has been the most challenging when it comes to service delivery for self-care commodities at subnational levels?
The most prominent challenge is stockout. That's the most, of course, there are other challenges, but the most prominent challenge is lack of, availability of the DMPASC. And that's understandable. The assurance, the confidence that women of Nigeria will accept self-care the way it's been, the way we see this acceptance wasn't there. It's everyone is surprised because we thought it could be maybe an urban thing, a racial thing, a class thing, but it broke through class, race, religion. Women really understood, the unique benefits of self-care, and self-care picked up. And then, so we are struggling as a nation with meeting up with that demand.
Demands.
Yes, and I really thank God. I'm not a politician, but I really thank God for the current Minister of the Federal Ministry of the Minister of Health and Social Welfare, Dr. Pate. It's been wonderful. Release of funds, meeting Nigeria's commitments. As I'm talking to you, the $4 million for procurement has been released. And this is the first time we are seeing such efficiency in the ministry. So the lights are very green.
Yes, I see that too, hopefully positive. So, but well, it's really interesting to see that the ratio of demand and supply, like there's more demand now, and we are now looking to see how we can make more supply, right?
Yeah.
Amazing. So, sir, aside the DMPSC, what other self-care commodities are available, or is SFH advocating for, let's say, like self-testing, and what commodities are available currently?
There are a lot of self-care commodities, a lot. In fact, there are self-care products that we use in our daily activities that you don't really know they are self-care products, right? So there are a lot of self-care products available and readily available in pharmacies and PPMVs. Oyare, your toothbrush is a self-care.
It's a self-care, of course.
Your toothbrush and your toothpaste, it's a self-care product. Yeah, but let's narrow it down to health, right? If that's where you want me
Sexual and reproductive health.
Sexual reproductive health. Your pregnancy test strip that you dip in your urine at home is a self-care product, right? To check pregnancy for itself, right? There are ovulation kits that has helped a lot of women to overcome infertility. They are with a dipstick on ovulation. They are self-care products. They are available. We talked about HIV self-testing kits. Society for Family Health distributed HIV and still distributing HIV self-testing kits in thousands, right? And then, of course, we talked about the self-injection, the depomedroxyprogesterone assisted self-injection, available, right? So there are so many, some are available in different service delivery points at pharmacies, at chemists, and at hospitals. But there are self-care products available. The important thing is that every one of us should be, aware of the concept of self-care and practice.
Okay, sir. So right now, how would you classify the feedback from primary healthcare professionals at subnational levels, like say other stakeholders, like primary healthcare professionals? How would you classify their feedback regarding the self-care initiative? Are you getting some sort of opposition or anything like that right now?
Yeah, just before the release of the latest National Demographic Health Survey, we had already known that there will be a leap bound in contraceptive prevalence rate because providers at primary healthcare at the subnational had already seen a lot of pull, right? People coming to demand for self-injection. And of course, some come for other methods, you know. So when you increase the method mix, if I was presenting now, I'll show you a graph that shows that as self-injection is increasing, the method mix is increasing, other methods uptake are increasing. You come to a very busy primary health care, and you see a queue with over 100 women, some carrying children, waiting. Some of them are just waiting to take a 3-month for the provider to give them an injection. But have to stand in the same queue. Today, some of those things can be handled by self, right? And providers will be able to have time to face more critical clients. So it's been a good feedback from providers at the primary healthcare level.
Okay, thank you very much, sir. Okay, so our last question for today is, what innovation or strategies do you believe, because we've spoken about there's a huge demand, but not so much supply, right? So what innovations or strategies would you believe is crucial for increasing this supply or improving the delivery for self-care?
The first thing, I will use evidence from the work the Society for Family Health Nigeria has done in this country in self-care. For women to self-inject, for people to, endorse self-care practices, one of the major barrier is fear. Fear of everything, fear of lack of confidence. I'm not a nurse.
Not a nurse.
Will I be able to do this? All those fears put together.
Will I get fat if I do that?
Exactly. Fear of side effects, fear of pain, fear of needle. All those fears put together constitute a barrier. And SFH, with our partners on the DISC project, came up with an innovative counseling method, which, interesting for you to know, Yari, has been also infused in the changed policy. So it's become a policy adopted in Nigeria by the Federal Ministry of Health for an innovative method, of dispelling fears, of counseling. And then, of course, there are other innovations I mentioned earlier. So for us, what we need to do is to scale these existing innovations.
Okay, amazing. This has been a very enlightening session with you, sir. Thank you very much for joining us on the show, and thank you so much, our esteemed viewers, for watching. This has been the Voices for Self-Care, and my name is Agari. And make sure if you have any questions, for SFH, or you have questions for WRA, or you want to just comment on self-care generally, please do make sure to comment on the comment section, or send in your messages to rancoms@gmail.com or contact@wranigeria.org. It's showing on your screen right now. Until I come your way again next time, my name is Oyari, and I'll see you next time. Bye.